Hello everyone, this is Dr. Shushma Sarila, consulting homeopath at Fidicus Homeopathy. Here we will be discussing why you're having these abortions or why you're not able to conceive. First, we will be discussing about it one detail. First one is physical distortion and obstruction. See, for example, this is the uterine cavity, right? And these are the fallopian tubes. If you're having a fibroid near the fallopian tube, okay, so it's obstructing the fallopian tube, right? So we have an ovum here which is waiting for the sperm. We have a sperm here which is waiting to meet the ovum. It is coming up but it is not able to meet the ovum. So you will be having conception problems, especially if there is a fibroid near the fallopian tube. Apart from this, if you're someone who is experiencing fibroid near the uterine cavity, so this is the fibroid and it is growing slowly. What will happen? This is the normal uterine cavity, right? So what happens is that when the fibroid starts growing, even if the baby has come here and it has been implanted, when the baby starts growing, this fibroid also will be growing and it will not be giving space to this growing fetus. That is where you will have this abortion. So physical distortion and obstruction are the major things why the pregnancy is very hard in fibroids. Apart from that, endometrial receptivity. What do you mean by endometrial receptivity? You have to remember that an endometrial layer should be in a certain way for the baby or the fetus to come and attach to it. Okay, so whenever you're having fibroids, this receptivity or this nature where it is trying to hold on to the baby or the fetus is gone. Okay, it's just like as if you have glue, something will come and attach to it and suddenly the glue is started to behave differently. It has started to behave like a gel. There is no attachment, right? I'm just taking it as an example. It is not what happens in the endometrium, but the endometrial receptivity to take and attach that thing will go off or it will behave in a different manner, so that there is implantation problem or it can be implanted very low wherein it can lead into an abortion. So this is also a certain thing that you will be facing if you are experiencing fibroids. And the other one is inflammation and autophagy. Remember that the fibroid has another character where it will also take a lot of blood supply. Okay, so it craves for blood supply even though if the baby is growing starting in a normal manner, because of its increased nature to take the blood supply, you will have deficient blood supply to the fetus and also deficient nutrition where it can lead to into a miscarriage. And this fibroid will release certain hormones. It can prepare its own estrogen. High estrogen level will cause certain reaction in the body. It can lead into inflammation where there is different chemical mediators being released into your body which can lead into problem with the pregnancy. And also we have this vagina uterine microbe, which is I've already discussed in the causes and risk factors. There are common bacteria in the gut. In the same manner, there are common bacteria in the vagina also. Whenever the vaginal pH is normal or it is maintained properly and the hormonal levels are maintained normally, the vaginal microbiome is also maintained in a proper manner. Whenever there is alteration in these hormones or alteration in the uterine cavity as such, because of the fibroid, which can create a hormonal disturbance and also uterine disturbance, there will be changes in the vaginal microbiome which can lead into infections. Okay, so it can lead into yeast infection, prolonged yeast infection, it can lead into bacterial infection, it can lead into recurrent UTIs. All of this can happen. Because why it can lead into UTI? Because that is a different system and this is a different system. Remember that women have very short urethra, so there will be problem. If there is UTI infection, you can get something like a vaginal infection. If you have vaginal infection, you can get an UTI in certain section of people. Okay, it depends upon the inert health as well. And also other factors like uterine contractility. What do you mean by uterine contractility? To expel certain things, uterine needs to contract or the uterus needs to contract. Whenever you are having a baby, if the uterine contracts, you will be experiencing abortion. All of these changes are happening in the uterus because of the fibroid. If I tell you that you will be having all of these problems with fibroids, it is only 50% of what I'm explaining. The other 50% people or the other 40% people will not experience any sort of changes in their pregnancy or will not experience any sort of symptoms also. So what kind of people will not be experiencing these symptoms? On what kind of people will have a healthy conception or will conceive easily and also will get a pregnancy easily, even though they are suffering from fibroids? Let's look into the topic more. Now let us get into the types of fibroids to know more on how it will impact the pregnancy process. As you can see here, this is the female reproductive system and these are the fibroids. Let us discuss in detail about each fibroid and its impact on pregnancy. So we have already known that the uterus consists of three layers, right? The endometrium, the myometrium and the perimetrium. Okay. So as you can see here, this type of fibroid is known as the serosal fibroid or the subserosal fibroid. So this fibroid usually grows outside the uterine cavity or the outer lining of the uterus. Okay, usually people who have their pregnancy, they get conceived, they have good pregnancy, they have good delivery. Even if they're having fibroids, usually they conceive in this kind of fibroids, even if they're having it. Okay, so this kind of fibroid will not interfere with the space because uterine cavity, as you can see, is normal, and also it will not interfere with other processes like conception, implantation or the growth of the baby. Okay, just we have to make sure that this subserosal fibroid will not grow in larger size, because if it grows a little larger, it can develop a stalk. Okay, it can develop a small stalk like we have in plants, and it can fall or it can give pressure symptoms on the rectum, which can lead into painful defecation, or it can anteriorly fall on the urinary bladder, which can cause painful micturition, which is also called as painful urination. Okay, so if you're having someone experiencing subserosal fibroids, nothing much to worry in the pregnancy. Just you have to make sure that the fibroid size is not large. Okay, it is very small, and also it is not growing abnormally, and that your hormonal levels are normal. Okay, if you're maintaining this, you can have a good pregnancy. But if you're someone who is suffering from intramural fibroids, which is fibroids which grow in the mid layer as of the uterus, okay, so if these are very small in nature, or even if they are multiple and very very small, like a grain of rice, or a little smaller, that is 1 centimeter, it might not affect the uterine cavity. But if they are growing larger and if they are more, what will happen? This uterus midsection will bulge, and also the uterus cavity will become small, so there will be abortion. But this kind of fibroids can cause pressure symptoms, like it can close this fallopian tube if it is inside, it can close the uterus cavity if it is inside. So this can cause a little bit of problem. If you're someone who is experiencing intramural fibroids and they're less than 1 centimeter, nothing much to worry. Maintain a good hormonal balance and eat well, so that you will not have a lot of problem in the pregnancy. And the third kind of it is called as a submucosal. This is the main villain, because they are growing inside the uterine cavity, and even if they are small, it can cause a little bit of problem, and if they are large, obviously there will be a problem. So the submucosal fibroids will obstruct the uterine cavity. If they're growing near the fallopian tube, it can obstruct the conception as well, that is the meeting of the sperm and the ovum as well, and it can cause a lot of pain also. So if you're someone who's experiencing submucosal or intramural fibroids, they're very small, very very small, less than 1 centimeter, the intramural, nothing much to worry. Maintain it properly. If they are submucosal, then you have to consult the doctor on a daily basis, so that you will have a proper pregnancy. But if you're someone who is experiencing subserosal fibroid, make sure it does not grow in size, and also make sure that your hormone levels are good, so that you will not develop a lot of other fibroids also. So these are the types of fibroids. The other type of fibroid is called a cervical fibroid. Usually it is stalked somewhere here and it is coming here. The fibroid has a stalk inside the uterine cavity. Okay, it can cause a lot of pain, especially during intercourse, and also it can alter the vaginal microbiome. So if you're someone who is experiencing fibroid in the cervical region, it is better that you first get rid of the fibroid and then go for or plan for pregnancy, because it will cause a lot of problem during delivery, and also it will cause a lot of problem even during pregnancy also. If you're someone who's experiencing fibroids and watching a video, if you want to have a good cure for your symptoms as such, you should be choosing Fidicus Homeopathy. In Fidicus Homeopathy, we have two kinds of consultation options. One is the online consultation if you're staying far away from the nearest branch of Fidicus, and in-person consultation if you're staying near the nearest branch of Fidicus. In online consultation, we have two options. One is the audio consultation and the second one is the video consultation. You can approach us through either one of it. And also, after the consultation has been done, and if you're having any sort of investigations already done, you can share it with us. After the case taking and the doctor consultation, the medicines will be delivered to you, especially to the online clients. Home delivery will be done. If you're staying in India, it will take 3 to 4 business days for our medicines to reach your doorstep. If you're staying in USA, it can take 3 to 5 business days. Across the globe, it can take 4 to 8 business days. If you want to contact us, you can contact us to the given number here, either through WhatsApp, either through call, or either through message. Okay. And if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you are experiencing any sort of fibroid issues, infertility, or female reproductive diseases like endometriosis, adenomyosis, chocolate cyst, or hemorrhagic cyst, PCOD, PCOS, dysmenorrhea, which is painful periods. If you're looking for cure, Fidicus Homeopathy is the answer. Why is it that you should choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. First, the reason for doing this video is itself because of the high and good amount of success rates that we are having in this female reproductive organ diseases. Second is the transparent treatment where there is no gray area between the patient and the doctor. We will be discussing you in detail about your prognosis. And the third thing is the personal care. The personal care here at Fidicus is really top notch. The reason for this video is because of the personal care. That is because in persons or the online clients have asked us so much of questions that we wanted to do a video in order to convey it and also in order to educate other people. So the personal care, we will be discussing in detail all of your myths. We will be busting it and we will be educating you. So if you want to choose cure, if you want to have an answer for all of your diseases, Fidicus Homeopathy is the answer. So choose Fidicus Homeopathy if you want to choose cure. Thank you.
Fidicus Homeopathy.